Infection really impacts the entire surgery that we do as plastic surgeons, and that can contribute to not only a superficial infection, but infection to the implant or foreign body that I may have placed underneath it, and that can be devastating for the result that I'm looking for.
If you get a total knee infection, they find this biofilm all over that device. They're going to explant it, and they may have to then put in antibiotic spacers, and this patient's going to have long-term antibiotics. It's devastating. They lose their jobs. They have family members taking care of them, or they might be in a rehab for months.
SSIs certainly impact our specialty. We really strive to avoid wound infections. This is a huge cause of morbidity for our patients. It can, increase length of stay, patient discomfort and distress, and so techniques to reduce surgical site infections are critical.
So there's some things that we'll do that will alleviate some of the surgical site infection risk. As we do the surgery, we'll actually use plus sutures, so that if there is a risk of an ascending infection, we feel that the plus sutures will alleviate some of those problems.
How antimicrobial sutures that have the antiseptic triclosan address SSI reduction is that just the small amount that's on this suture can actually prevent them from proliferating into an actual infection.
After seeing the plus sutures and seeing that zone of non-adherence around the Triclosan-Coated sutures, that was really impactful to me, because I know that the second I close the wound, the second that I put suture into the incision, there's biofilm forming on that suture.
Plus sutures have sort of changed the game. In my experience, ever since I've started using them, superficial cellulitis is almost non-existent in my practice, which has been a tremendous, tremendous advantage.
We can really do something to decrease that bioburden that immediately starts to happen once we put those sutures in, and gives me more confidence in the closure that I'm doing.
What I found is, as time went on, that my incidence of cuff cellulitis and vaginal hysterectomy declined. And I was trying to figure out, what's changed? My procedure and my technique hasn't changed. But I did find, as I went back and reviewed some of the things we were doing, it was the introduction of the plus suture that made a reduction in my cuff cellulitis and vaginal hysterectomy.
You look at things like scarring. Anytime you can prevent excessive inflammation or a superficial wound infection, you're going to wind up with a much more pleasing scar.
So plus sutures, more than just about anything that I use in my practice, has the best evidence behind it. The amount of data that's available internationally in the US, looking at meta-analyses and randomized control trials, it's pretty convincing evidence. I've lost a lot less implants to surgical site infection than I have before I implemented plus sutures.
But when you've got that much evidence and these guidelines saying to use them, it should be part of the bundle, period. When I was a corporate director in a hospital system, we actually implemented the use across the board, and we had close to a 38% reduction in our infections with using them.
There is a significant improvement in surgical site infections. So for me as a surgeon, there is zero reason not to be using them in your patients now. And there's no other product that comes close to be able to do what they've done with plus sutures.